Welcome to this explainer. Okay, so if you're sitting there right now, maybe rubbing a sore neck after a long day hunched over your computer, well, what we're about to cover might just completely change how you view your spine. We're going to unpack the mystery behind that chronic neck pain, the stiffness, and a super common condition called cervical spondylosis. Now, if you've ever dealt with a stiff neck, let me tell you, you are definitely not alone. A staggering 85% of people over the age of 60 are affected by this age-related degenerative condition. 85%. That is a huge number. But here's the real kicker. Because of how we live our lives today, the structural changes that actually cause this condition, they're showing up in patients much, much younger. To make all this complex medical info super easy to grasp, we're going to follow a clear 6-part roadmap today. The aging neck explained, anatomy of the breakdown, diagnosis and red flags, evidence-based treatment options, real-world clinical cases, and finally, prevention and prognosis. All right, let's kick things off with part 1, the aging neck explained. We'll look at causes, risk factors, and something called text neck. So while getting older and just natural disc wear and tear are the primary drivers here, they really aren't the whole story. Our modern habits are the absolute accelerators. Just think about text neck for a second. When you're staring down at your phone, your head is essentially acting like a 10-pound bowling ball just hanging right off your cervical spine. Combine that with a sedentary lifestyle, being stuck doing office work, maybe some previous trauma like whiplash, and weak neck muscles, well, you've got the perfect recipe for speeding up that spinal breakdown. Moving right along to part 2, anatomy of the breakdown, microscopic pathology of the spine. Okay, I want you to think of your intervertebral discs as the shock absorbers for your spine. Early on, in stage 1, they just start losing their water and elasticity. Basically, they dry out. Because of this, they literally flatten out in stage 2, which decreases your overall disc height. With that nice cushion gone, the facet joints at the back of your spine start rubbing together, and that leads to stage 3, which is osteoarthritis. Now, to try and stop that painful wobbling, your body's defense mechanism kicks in during stage 4, and it actually starts growing brand new bone. We call these bone spurs. But, the domino effect doesn't just stop there. In stage 5, a really key stabilizing ligament called the ligamentum flavum actually starts to thicken. When you combine that thickened ligament with the flattened discs and those new bone spurs we just talked about, we hit a serious bottleneck in stage 6. The natural bony windows where your nerves exit get narrower. By stage 7, those nerve roots are getting pinched, and in severe cases, which is stage 8, the actual spinal cord itself can become dangerously compressed. Now, there's a vital clinical distinction we need to make about those pinched nerves. When just a specific nerve root is compressed, it's called cervical radiculopathy. This usually feels like a sharp pain, maybe numbness or tingling radiating all the way down one arm and into your shoulder or hand. On the flip side, if the main spinal cord itself is compressed, that's called cervical myelopathy. This is much more severe. It often shows up as a loss of balance, trouble walking, or even losing your grip strength. Knowing the difference between these two literally dictates the entire treatment path. Next up is part 3, diagnosis and red flags, knowing when to seek immediate help. Look, most neck pain is just exactly that, a total pain in the neck. But if you or a patient ever experiences these stark red flags, you need urgent medical evaluation right away. We're talking about progressive arm or leg weakness, difficulty walking, or sudden clumsiness in your hands. Like if you find yourself suddenly dropping your coffee cup or struggling to button a shirt. And the most critical red flag of all, any loss of bowel or bladder control. These signs point to severe neurological compromise, so do not ignore them. So how do doctors figure out exactly what's going on? Well, to confirm a diagnosis and see what's being compressed, they rely on a few different imaging tools. An X-ray is an awesome starting point to spot those bone spurs, narrow disc spaces, and just the overall curve of your spine. But if we're looking at soft tissues, the MRI is the absolute gold standard. It's the best way to visualize nerve roots or spinal cord compression. Meanwhile, CT scans are usually kept in reserve for when doctors need to see really intricate bone detail, especially if they're planning for surgery. All right, part 4, evidence-based treatment options, finding relief through science. Whenever patients hear scary words like spinal degeneration, arthritis, or bone spurs, the very first question they ask in a total panic is whether they're destined for the operating table. Let's be honest, it is a terrifying prospect to imagine getting spinal surgery just to fix a stiff neck. But hey, I've got some genuinely good news for you. When you look at the gold standard clinical guidelines from the American Physical Therapy Association, the American Academy of Orthopedic Surgeons, and the World Health Organization, they are all completely united on this. Conservative care is the absolute first-line treatment. The vast majority of patients improve significantly with just conservative management, and they never even need to think about surgery. So, physiotherapy is literally the cornerstone of this recovery process. It relies on active rehabilitation, not just laying around resting. We're talking about correcting your computer workstation setup and getting specific postural training. A huge focus is placed on deep cervical flexor training. That's essentially strengthening the core muscles of your neck, often using simple chin tuck exercises. When you combine that with stabilizing your shoulder blades, your scapula, and doing targeted stretching for those tight upper back muscles, this whole physical therapy protocol effectively takes the pressure right off those worn-out discs and joints. Let's dive into Part 5, Real-World Clinical Cases, Applying the Guidelines. Okay, let's look at a classic example with Case Study 1, the everyday office worker. This patient is dealing with chronic, aching neck pain and a whole lot of stiffness. Luckily, there are zero major neurological red flags here. This is just the result of years spent slouching at a desk, looking down at a laptop, and carrying way too much tension in their shoulders. For someone like this, a customized, non-surgical treatment plan works wonders. It heavily focuses on ergonomic tweaks, getting that computer monitor right up to eye level and properly supporting the arms. Clinically speaking, they'd start doing deep neck flexor strengthening to really support the cervical spine. Add in some targeted stretching for the upper trapezius to release that built-up tension, plus ongoing postural re-education, and you're essentially reversing the daily mechanical strain of having a desk job. Now, on the total opposite end of the spectrum, we've got Case Study 2. This is an older adult presenting with cervical myelopathy. Remember what that means from our anatomy breakdown earlier? Their main spinal cord is actively getting compressed. Because of that, they're actually losing their balance, struggling to walk, and getting really clumsy with their hands. Obviously, a severe scenario like this dictates a completely different path. It's a perfect example of when surgery is absolutely vital to stop permanent nerve damage. After an urgent medical assessment, this patient would likely have a surgical intervention, something like an anterior cervical discectomy infusion, or ACDF, to decompress that spinal cord. Then, right after surgery, the goal immediately shifts to early mobilization and a super rigorous rehab program dedicated to getting their balance and function back safely. And that brings us to our final part, Part 6, Prevention and Prognosis, taking control of your spinal health. The research is clear. Simple, daily lifestyle changes are absolutely your best defense here. It means you have to consciously pull your screen up to your eyes rather than dropping your head down. It means putting a limit on that prolonged mobile phone use. You should also be taking frequent movement breaks during your workday, doing some regular neck and shoulder strengthening, and maintaining a healthy body weight with an anti-inflammatory diet that's packed with vitamin D and calcium. To sum it all up, catching this early and focusing on good posture can literally prevent serious disability down the road. The prognosis is actually super optimistic as long as you're proactive. So I want to leave you with this one final thought. The next time you reach for your phone to start endlessly scrolling, stop and ask yourself, is this one text message really worth the long-term wear and tear on your spine?